Let's get back to ADD, ADHD. Tell us give us a succinct definition. What is it, and what do parents see, or what should parents look at to know when a child has ADD or ADHD? And before we go back into how it comes arise, or what you think are the causes from your studies and research.
Typically, parents see poor focus. Well, they see an inability of a child to focus on tasks, to complete tasks, whether it's at school or at home. You ask them to do 3 or 4 things, and they may do one, they may not finish that task. And typically what you see in school is the same conversation by the teachers, which is that your child is not performing, they're distracted, they're distracting other children, they are not doing what they should be doing. And many times it's thought that these children are just naughty children or misbehaving children. But over time, many teachers will come to say this child may have attention deficit or they're hyperactive. And so the terms ADHD come into play, or ADD come into play.
I see. Okay. So it has a lot to do with focus. Is there a lot of noise making? Are they unruly? Do they affect the rest of the class?
They can be unruly. They can affect the rest of the class. Or they may just simply look as though they're staring into outer space and not paying attention whatsoever.
Okay. Right. Is there a demographic? Is it more among the more affluent or the less affluent?
No, that one has no demographic truly. It is not affected by race, color, financial situation, economics, none of the above.
Got it. All right, so take us back into what you believe are the causes and how this thing comes up, why there's so much of it these days.
Really, what we consider these focus and attention issues are due to a strong contribution from what we believe to be too long a use of folic acid in pregnancy. Folic acid is really necessary for the first trimester of pregnancy. So please understand, we're not saying don't use folic acid. That would be a big mistake. You need folic acid to make sure that what we call neural tube defects don't happen. That's a problem where the brain doesn't develop properly. You need to do that for at least the first trimester. So you take your folic acid when you're getting pregnant or looking to get pregnant, and then you take it throughout the first trimester of pregnancy. So you know for sure you're pregnant, take it for an additional 3 to 4 months, and then you're good. The problem is when you take it far longer than that, that can actually be one of the factors that can predispose your child to having ADHD.
That is interesting. That is really, really interesting. And you have data and research for this, Doc?
Oh, absolutely. Absolutely. We see a very strong correlation. If you can even do this one yourself, you look at the rate of increase of ADHD and autism for that matter, and the timing of when we started suggesting that our mothers, pregnant mothers, take folic acid beyond the first trimester. You'll see the slopes matching up perfectly in the research. See the slopes perfectly, perfect increased correlation between the two. And we also know empirically that most of the children who have ADHD are what we call under-methylated. Methyl molecules being regulating switches, if you will, and there are not enough of them. And folic acid actually removes more of these switches from your system and the level of DNA. Okay, that's where it counts. And that's what excessive folic acid does. And we see that all these children are low in these switches. So we can draw 50,000 different correlations, but the fact is they're coming up with the same points. Folic acid is key, timing is key, and excess usage is key, along with genetic predisposition.
So you're saying that, and I know there are other causes for ADHD, but you're saying that even given the right doses after the first trimester, not even overdose, even given the right prescribed doses by the doctor, can result in a higher risk for ADHD?
Absolutely. Absolutely.
That's fascinating. Okay, well, what we're going to do, Doc, is we'll try and get some of this research and information. If any that you can spare, we'll put it on our website. So if people want to get more information, they can go to it, if you don't mind. So just in case they want to know about it. Okay, sure. So thank you. Other than folic acid, what are the other things that you've seen?
Quite often in children, this is not a pregnancy issue. This is after pregnancy. But many children who are high in copper levels can actually exhibit focus and attention challenges because copper is a neural stimulant. It is truly one that affects nerve cells as a great conductor of electricity. Anyone who works with mechanics and electronics knows copper conducts electricity well. But the human brain is an electrical and a chemical organ. And so those same rules apply. High levels of copper can cause nerves to discharge in the brain very rapidly and in an uncoordinated fashion. Now, that is what leads to the poor focus and attention because your brain is constantly being distracted by something else as the nerves are firing in the mind, in the brain.
What's causing the high levels of copper in these kids?
For many children, it's actually an inability, especially females, it's an inability to process that copper. But that genetic challenge can also come from a mother given to a son. So that's what, but boys are not designed to handle copper, girls are. And the reason why is because copper is part of the process of developing blood vessels, by which ultimately one will need to develop blood vessels for a developing baby that a female will carry. Males don't carry babies, so the male system is not quite so used to having higher copper.
At least not yet, Doc, not yet.
Not naturally, put it that way.
There's a lot of things happening in your country over there over here in the US. It's kind of
and they're crazy, and they're very problematic as well. It's not going to happen. So.
Okay. So copper. So there's a genetic deficit in the metabolism of copper.
Yes.
That makes them.
And even diet. So high carbohydrate diets, high starch diets can predispose individuals to develop yeast in the gastrointestinal system. Yeast in your intestines can literally produce toxins that go to the brain that now cause poor focus and attention.
Okay, tell us about that because that's of particular interest to us in Africa, obviously. So yeah, let's hear some more about that, Doc.
Well, let's look at some of our foods that we eat. So, Doc, we talked about fufu at the beginning. Okay, in Ghana we have etso and banku. All these things are starch-based potatoes, French fries in the modern times, so-called bread. Oh, I always say the best bread on the planet is in Ghana. I'm so sorry to tell you this, but
you can have the bread. We can have the jollof rice. So you're good.
Thank you. You can keep the jollof rice. Very well known to both our cultures, but these starches, even the jollof, can produce yeast in our GI tract. Yeast feed off of carbohydrates. And so as they grow, they produce toxins. They produce what is called a leaky gut. And when the gut is no longer tight and begins to leak, now toxins flow from one area to another area into the bloodstream and create inflammation in the brain. Also, when you have the leaky gut, even feces, small amounts can get into the blood system, which is toxic. And that's what leads to the poor focus and poor attention. Now, this leaky gut can be healed, but I just wanted to show you that when you have yeast, they create inflammation. That inflammation and the toxic elements that get into the bloodstream now affect the brain's capacity to process. And that is yet another reason for a poor focus and attention. So diet can play a very major role.
It's gonna be hard. It's going to be a hard sell to get people to stop taking fufu. I can tell you that for one, Doc. And that's a losing battle right there. So what can we do about it other than losing off? Stop eating pounded yam, fufu, and jollof rice. What can we do if there are kids with this problem?
Well, here's the difficulty. So moving against these kind of cultural norms is extremely difficult. Now, when we talk about ADHD in particular, what we're really saying is, look, we have to change some things. We're not talking about everyone. This is not something that's mandatory for everyone. Just those individuals who have all these predisposing factors. And yes, unfortunately, Now, we have to get rid of the bread. We have to get rid of the fufu. We have to deal with vegetables and meat. Vegetables and meat. You can cook the vegetables however you like, with whatever seasons you like. But breading and starches got to be removed. Okay. If you have serious cases of these conditions, this is where it's culturally very difficult. I don't know a country on the entire African continent that doesn't have rice as a staple. It doesn't have some starch as a staple. Okay. But these are the conditions that we're looking at now. So for that one individual, that one child, this is part of the process. Okay. There are other things that can be done, but if you're talking about yeast as the primary cause, then it has to be corrected. If you're talking about something else as the primary cause, then the diet is not so much an issue. Okay. For example, high levels of copper, as we mentioned. When that's an issue, diet is not involved.
So then what can be done? Because forget it, doc. They're not going to stop eating bread. And remember this whole story about the guy on the ledge and it's like, help, I'm going to die. And then someone speaks from above and says, hey, I'm God. Trust me, believe in me. And then come on, just let go. And the guy says, you know what the guy says, is there anybody else out there who can help me?
Yes, right.
But so it's a lost cause. What can we, is there anything that we can do on this?
Now I'm going to give you a couple of things that you can do actively without changing your life, okay? And because if you don't have direct testing, it's harder to say with what certainty these things will help. But tyrosine is a nutrient that you can take. For children, usually about 250 milligrams of tyrosine in the morning can improve focus and attention, especially in undermethylated people.
That's an amino acid, isn't it?
Correct. I want you to remember the adage, for every drug that's out there, there's a natural agent that can do the same thing. That's what for adults, 500 milligrams of tyrosine.
Okay.
Now, there's another one. Here, I'm just going to give you the initials, DM, as in Mary, AE. 100 milligrams per day in the morning for children. So if the tyrosine doesn't work, you can try DMAE.
Okay. Thank you. That helps. That 100 milligrams, is that for both adults and children?
That one is for children. For adults, 200 to 300 milligrams.
300. And that can go some ways towards settling the child down.
That's for focus and attention.
Focus and attention. Got it.
That's different than behavior. If you have an erratic child, we recommend inositol or Gabamax. That's more for calming anxious children, not for focus and attention.
So tell us about that again. Are you comfortable telling us the Gabamax?
Gabamax, Gabamax, is a good one for calming children who seem anxious. Gabamax, 1/3 of a teaspoon twice a day. It's a powder.
Powder, okay.
Now here's one if you want to order from Amazon called Gabatrol. That one can actually help with focus, attention, and calming of an anxious child. And you take it as Gabatrol, Gabatrol. It's on Amazon.
Fantastic. Folks, these are not medication. You would not be prescribed medication over the online. These are simple supplements that you can use to help your kids. And there's a very wide safety margin, right, Doc?
Absolutely. These are absolutely benign. These are not drugs, so there are no side effects.
Right.